Welcome back again as we continue our Aurum Stay at Home series, trying to keep your mind fresh and sharp during this downtime. I am Jason Zelmer. I'm the National Director of Sales and Practice Growth with the Aurum Group. And I've got a pretty funny guest here today. Yes, he's smart. Yes, he knows his stuff, but he is a fellow comedian like myself. And that is Dr. Curtis Westersund. Can you wave to the crowd, Curtis?
Hi, everybody.
Dr. Curtis Westersund earned his DDS from the University of Alberta, U of A, in 1979. I know it doesn't show on him, but he has been practicing here in Alberta for 41 years, so he knows his stuff. But most notably, his practice is focused on the treatment of temporomandibular disorders, so TMD, and that's a physiologic approach to the diagnosis and treatment. He holds a mastership with the International College of Craniomandibular Orthopedics, otherwise known as ICMO, and he has been published in the scientific journal Cranio, which is the Journal of Craniomandibular and Sleep Practice, with a clinical trial on the effect of postural alignment and dental occlusion. So big mouthful coming from me, but I know that you'll certainly be able to elaborate on that for everybody, Dr. Curtis.
Well, thank you for the nice introduction. If I had blood, I'd be blushing. But yeah, basically the last 20 years, I have been focused on treating patients that have chronic pain, chronic problems with TMD. And it all started with the fact that I was a TMD sufferer. I had migraines, I had teeth that are breaking down, teeth that are wearing out. I didn't have any clicking, but I had problems. I couldn't swallow a pill. I had trouble with snoring at night, all these types of things. And when I started treating myself, I started getting better and started getting healthier, and I got more and more of a passion into this. And that was 20 years ago. And so now we've been mostly just doing TMD type therapy.
So you teach about practical clinical treatments for TMD and TMJ. Tell us a bit about that.
Well, you know, we don't get a lot of education about TMD, TMJ when we're in dental school. So I speak to a lot of dentists out there, but I know that I myself, and I don't want to speak for other dentists, but I know that for myself, I got very little information, very little idea how to treat, and very little relevance to what TMD is. So it became a very interesting learning process for me, and I try and share that with other dentists so they don't have to go through 20 years of learning how to do this. I mean, we all have busy days, we all have busy practices, and sometimes the education part of it has to be sort of boiled down to what actually works.
Okay, so you've been doing this a long time. What is TMD now, and how has it changed versus, say, 20 years ago when you started treating yourself?
Well, that's a good point. Dentistry is moving. Dentistry is going off into the distance. And it's kind of like the way that we look at how we used to look at functional dentistry. And we would look at the aesthetics, we'd look at the the mechanics of tooth position, gum position, etc. And then finally, after everything is all done, worry about the function, the occlusion. That's changing. Nowadays, everything's digital. We have a lot more digital aspects. Everything from planning, you know, say an implant case, or planning a beautiful smile, or even just taking x-rays, right? You take x-rays to look at all the teeth and all the bones and all the relationships. One of the things we're not doing is we're still using analog paper, inked paper, to figure out what the occlusion is. And so that can be a little bit of a problem. We should be going maybe more digital there. But the other thing is that dentists have been looking at patients as just this head. And it's like the head floating in space. And we really need to shift, therefore, from a mechanical idea about how we do dentistry to a biomechanical idea about how we do dentistry. Interesting point. I have 2 rules in my office. Rule number 1 is every patient that comes into my office must have a neck, torso, and some assortment of limbs attached to their head. I will not see a patient with just a head.
Seems like a fairly good rule, yeah.
A fairly good rule. It's I don't get a box and like open it up. Oh, Mrs. Jones, how you doing? So we don't get that, right? That doesn't exist. And so us treating the mouth in isolation, the jaws, the nerves, the various different organs inside the head in isolation is probably not the best way to approach our patients.
Do we want to know what rule number 2 is?
Oh, rule number 2 is every patient that comes into me must be able to breathe.
Okay,
and
another
must be
good
breathing
rule.
on a regular basis. So
essentially, you're not going to treat dead people.
No non-breathers. If you happen to be, the Walking Dead, the zombies, no, we're not going to do that. We only treat breathers. And actually, there's an important part of that because not only do they have to breathe well at night, and one of your webinars is being given by a very good friend of mine, Dr. Suresh Akandi, and he talks about that night stuff. That's really good. But we also breathe during the day. And things that can happen with our daytime breathing can affect us and how we develop and how we grow and all those types of things.
I agree. So TMD and TMJ, it's all about alignment and the jaw and the bite. A lot of it's in the bite, in which I am actually a patient of this with you. And we realized that my bite was quite messed up and was quite a big contributing factor to a lot of my neck issues. So is the bite that important to TMD and TMJ?
Well, yeah. So the bite, the way we bite together, has this descending effect on the rest of us. The bite can actually change the way you balance on one foot or the other, the amount of sway that you have in your stance. Basically, your postural stability can be affected by your bite. I've seen patients with very tiny little occlusal fillings that had a slight high spot when they drifted to the side with their bite that dramatically affected their head and neck alignment, dramatically affected their hips, whether or not their hips were rotated or twisted, and actually affected knees down to the feet. And so these things are, as I said, all connected. And the importance of what we do as dentists is really cool because, Jason, we used to just be mechanics, right? When I graduated, that was all we did, is we were just doing, oh, I just touched my face. Did you see that? Hold on.
I did. I was going to say something, but I'm glad you got it.
I have my bottle of hand sanitizer right here.
I hope everyone watching does.
Yes. Ooh, lemony mint. It's fresh. So we have this ability. Where was I? I have no idea where I was. We have this ability to affect the whole body, and it's really cool because we used to just be mechanics, but now we can actually help other healthcare providers with their problems and get referrals from other healthcare providers to us to offer assistance and offer some help, and that's really cool.
I was going to say too, there's alcohol and that stuff, and I know with the pandemic that day drinking's become kind of widely accepted, but be careful with that stuff. That's a high level of concentrate of alcohol.
Well, number one, I don't drink. Number two, the flattening of the curve. My wife says I needed to flatten the curve, so I've been on a diet for the last 3 weeks. trying to flatten this curve so that I could stay healthier if that was an option.
I do find it funny because, you know, just in being around you for the last 7-8 months, I've learned a lot about this, and it's how many people, there's so many people, we couldn't put a number to it in this world, that suffer from jaw pain and lockjaw and migraine headaches, and they can never get answers. And it's crazy to find out how much is related to occlusion and that alignment. And so what else should a dentist do?
Well, first let me go to your first statement, which is a little bit, and then I'll get to the second one, what a dentist should do. So the first statement is that we're all talking about TMD. Oh, this patient's got TMD. This patient's got TMD. Really, we haven't. TMD is not a diagnosis. TMD is basically a basket of all these signs and symptoms that could be related to what you do. Now, how you define TMD becomes a little bit more important when we start to look at the whole body. But once you start to add up all the signs and symptoms you can have, I've got over 150 signs and symptoms that are actually related to a malocclusion, a bad bite, bad airway that affect the jaw joint, the head, the neck, the body, and how you function. So there's this idea that, you know, a patient comes in and TMD is just situated 2 inches around the ear because of the TMJ, and they quite often patients will substitute TMJ, or doctors will substitute, oh, they got TMJ problems for TMD problems. It's actually more complicated than that. How many patients? Well, I think if you do the number of patients that you have that could have 1 to 150, heavens forbid, 150 different signs and symptoms, and you vary the severity of the signs and symptoms and the timing of the signs and symptoms, there's probably that number is greater than the population of the earth. So there's a lot of people that can show TMD signs and symptoms.
Okay.
Now, let me add one more thing to that. Pain is not the metric of health. So pain isn't really the problem. You can have something that's not painful, and it can cause still lots of problems. Okay. So let's think about this. What if you had a painless cancer? Would you be concerned about it? Of course.
If you knew about it, you would, but you probably don't know about it.
Well, what if you knew about your painless, partially occluded coronary artery? Would you wait for the drama, the heart attack? Okay. Probably not. So the same thing happens. Pain is not health, health is health. So we need to look at things that aren't painful with regards to our diagnosis and help the patient, and look at things that may become painful for the patient. So what can the dentist do? Look, observe, ask, try and give a more encompassing diagnosis, and then inform the patient, because many of these things are going to be problems. You just don't know.
Excellent advice. And my final question for you is the obvious one. Anybody attending your course, what are you really going to be doing and focusing on? You've answered it for the most part, but.
So what we want to look at is we want to look at how TMD pain solutions can go to the general dentist and to the specialist. Okay. So we want to look at what does our everyday patient show up with. And they typically show up with one of 3 problems. Either their bite is imbalanced, and we're going to discuss that. Their bite is misplaced, probably due to jaw growth or some other type of treatment. And the third thing is their bite is being influenced. So their bite's actually being influenced by their posture. And there's postural strain creating changes in the head-neck alignment, which makes changes in the way that the teeth mesh together.
All right. Well, I'll remind everybody the title of the webinar next week, or not next week, the week after, is TMD Pain Solutions for the general dentist and specialist. It will be myself, really not anything to do with me. I will introduce you. It's going to be your show. But Thursday, April 16th, 10 o'clock Mountain, noon Eastern Standard Time. If you're finished watching this video, you'll notice there is going to be a link below. These fill up really fast, so please register. I know that for the most part, you're sitting at home with a lot of time on your hands, so you should be here with us. I am Jason Zelmer. This is Dr. Curtis Westerson. And have you got any parting words for anybody?
Just, hey, thank you. If you guys want to be educated about TMD, come and listen and stay safe. Wash your hands. Use sanitizer of whatever form that you have, but basically self-isolate.
Yeah, that's good. Look forward to seeing you all on the 16th. Take care and have a fantastic day.
Will do.